According to Deanna Pan, a former senior editorial writer for Mother Jones magazine, between 2009 and 2012, states cut $4.35 billion in public mental health spending from their budgets. Iowa recently closed 2 of our 4 mental health facilities, two in Mount Pleasant and Clarinda, because the governor, Terry Branstad, contends that most of the 2 state hospital services could be provided more effectively and efficiently by private agencies. After reading a number of policy papers and reviewing the 2005 documentary Frontline, The New Asylums about the use of prisons to treat the mentally ill, I believe that our current system must be changed. What should be done to end criminalization of mental illness in the United States? I will discuss the following aspects of the issue. First, a brief history detailing how the mentally ill ended up in our prisons. Second, an analysis of our current situation. And finally, a proposal to decriminalize mental illness. First, a brief history of how the mentally ill ended up incarcerated. Before the 1840s, the mentally ill or insane were primarily kept locked up in asylums where the conditions were unregulated and the patients were subject to the whims and brutalities of the guards, according to Dorothea Dix, a school teacher and activist for better treatment in the 1840s. Dix led a movement to open better facilities and provide more humane treatments, resulting in the establishment of 110 psychiatric hospitals by 1880, and by 1900, every state in the United States had a mental institution. According to Sarah Glazer, a health, education, and social policy issue writer for the CQ Researcher, mental hospitals and institutions were used primarily to care for the mentally ill until conscientious objectors working as attendants in institutions in 20 states during World War II went public through the press and congressional testimony to protest the abusive treatment of patients. In response to these tragic stories, the movement for deinstitutionalization began shifting our mentally ill patients from hospitals to outpatient treatment in community health clinics. Additionally, psychotropic drugs like Thorazine were developed in the 50s to treat schizophrenia and other illnesses that created a pharmaceutical revolution that provided further impetus to close the mental hospitals. Legislative policies began to impact the deinstitutionalization movement as well. President Truman signed into law the National Mental Health Act, which established NIM to conduct research into neuropsychiatric problems. President Kennedy urged Congress to provide $3 billion in state grants for community health care centers, which was never fully funded. In 1965, the Medicaid Act was put into law, including a provision to deny reimbursement to mental hospitals for care, which resulted in the release of most of the patients to nursing homes, general hospitals, and onto the street. In 1980, President Carter signed into law the Mental Health Systems Act to structure and improve community hospitals and mental health care center programs to improve services for mental health and mental illness. However, in 1981, Ronald Reagan repealed Carter's decision and ended the federal government's role in providing services to the mentally ill. That decreased federal spending for mental health care coverage and services by 30% overall, and by 1985, it was down another 11%, and it has been cut further every year since. According to Deanna Pan, in her article, Deinstitutionalization and Its Consequences, the number of mentally ill people in public psychiatric hospitals peaked in 1955 at 560,000. In 2010, the number of hospital beds available to psychiatric patients in the United States was only 43,000. The same ratio as in 1850, before we even had any mental institutions. Without access to medical care and institutional community-based settings, the mentally ill are being incarcerated. Sarah Glazer notes the number of mentally ill inmates has mushroomed as states have closed their psychiatric hospitals in favor of outpatient community mental health centers that are typically underfunded and overcrowded. According to an article in Behavioral Health Science magazine, jails have become America's new mental institutions. The war on drugs and the three strikes policies have led to a 700% increase in the nation's prison population from 1970 to 2005 and peaked at 1.6 million in 2009. In California alone, 1 in every 8 prisoners is receiving some mental health therapy or counseling. 10% of them are on psychotropic drugs, and 2% are in 24/7 facilities for mental treatment. The police are frustrated by their repeat encounters with people who are causing problems in their communities, and they clearly need mental health services. Johnson County, or Iowa City, is currently considering crisis intervention training for their police officers and a mobile crisis center to respond to mental health emergencies. I argue that rather than continuing to utilize our criminal justice system as a primary method for dealing with what is clearly a crisis in the provision of mental health care in this country, that we should address the problem by fully funding community-based healthcare services both at the state and federal level. First, we should fund a system of mental health courts like the one in Miami-Dade County, Florida, that provides drug treatment and psychiatric counseling for the mentally ill. This program has decreased recidivism, or reoffender rates, from 70% to about 20% since the year 2000. Second, we should fund crisis intervention training for police officers to ensure that de-escalation is the primary response when law enforcement is called to the scene of a disturbance, rather than incarceration. And finally, we should fully fund community-based mental health care facilities and staff them. And in Iowa, this would require reopening some closed facilities, opening facilities where none have existed, and expanding current programs. Funding the facilities will require the following changes. We have to lift the cap that insurance puts on mental health care over the lifetime of a patient. We have to offer student loan forgiveness programs to mental health providers. And we have to fully fund the National Excellence in Mental Health Care Act, which was instituted in 2015. We cannot ignore the fact that mental illness exists by imprisoning schizophrenics, the addicted, and others suffering from what are treatable illnesses. We have a problem. A crisis in mental health care that was created over time has resulted in an exploding prison population, underfunded mental health care system, and a fundamental misunderstanding of the needs of the mentally ill. I urge you to support initiatives from local, state, and federal officials as they seek to contend with our mental health care crisis in this nation. And mental illness is not a crime. And as a society, we need not treat it as one.